All righty. Everyone able to see this okay? All right, I'll turn it to you now, Rachel. Thank you.
All right, sounds good. So this might be a repeat for some folks, but always like to run over this for any new folks, mostly just to go over the specialty pharmacy and what's different about specialty. So we can go ahead with the next slide. Just have some objectives on here. And the main purpose of this, please feel free to stop me, ask questions throughout the presentation. I just wanted to kind of demonstrate or define what's a specialty medication, what's a specialty pharmacy, why do I have a job, why am I employed, what do I do, and discuss why specialty pharmacies exist and what we can do to partner to try to give patients the best outcomes with their Hep C therapy and their other medications. So next slide. So why are we special? And that's the question I always get. What's so special about your pharmacy? So quick definition here, specialty medications. This is the formal definition from the American Pharmacists Association. So this is one of the formal definitions that you'll see of a specialty medication. So something that's more complex than a traditional. What does that mean? That's real vague on purpose. And, complex disease states are what we're kind of following with these medications. And then the specialty pharmacy focuses on those. So we primarily focus on dispensing medications for those patients that have really expensive medications, lots of follow-up that's needed, and then offer services. So helping keep patients on therapy, helping with side effects and those sort of things. So I'll touch on the different services for the pharmacy. If you go to the next slide, it's got some of the different various definitions of what kind of constitutes a specialty medication. So like I said, that was a very vague definition from the American Pharmacists Association, and that's what you're going to see. You're going to see a lot of variability amongst specialty pharmacies on what they define as a specialty medication. So a lot of the most frequent kind of criteria is what I have listed here. So these are medications that have special handling, things like being refrigerated. Are they hazardous? Things like oral oncolytics. Any sort of special handling along those lines, as well as special monitoring. So I have REMS here because that's kind of the first thing that pops into my mind. So a lot of times with some of our medications, we got to make sure we follow whatever those REMS guidelines are, making sure a patient's not pregnant, that they get their labs done, those sort of things. And then medications that require a lot of monitoring, like I mentioned before, whether they need to come in for labs, and then keeping those patients on therapy where adherence is so important. So very specific to hepatitis C, like we talk about here every other week. And those medications are often high cost. So CMS recently, gosh, I guess it's not recent. I want to say that was in like 2017, so maybe not recent, but their most recent definition of a specialty medication is one that costs more than $670. It used to be $600, so you'll still hear a lot of people quote more than $600 because let's face it, $600 is a lot easier to remember than $670. So you'll often hear over the $600 per month constitutes a specialty medication. So that gives you that annual cost. A lot of times I'll see a patient on something that costs anything from $6,000 to at this point now, some of the medications are even over $1 million for the year to be on. And oftentimes they're going to require financial assistance because these things are crazy expensive, and it is impossible, even with insurance, for patients to be able to afford a lot of these. And I know we talk about that a lot with hepatitis C and the cost of the hepatitis C medication. So that's one of the services that some of the pharmacies are able to provide to help patients afford their medications. If you go to the next slide, I wanted to kind of touch on some of the different disease states. I have them listed here. So these are ones that our specialty pharmacy does deal with and are common just in the specialty space of other pharmacies that help and define specialty disease states. So I have hepatitis C and HIV here, since that's what we're really focused on in this group. So our pharmacy and a lot of pharmacies do consider Hep C, even hepatitis B and HIV as a specialty disease state where they provide patients additional services. So next slide. I just wanted to kind of talk about accreditation briefly. This is one thing that is kind of important for me from a specialty pharmacy standpoint. And the only reason I bring it up is that the accredited pharmacies have specific guidelines, policies and procedures that they have to follow in order to be accredited. So it's kind of like that, gold star standardization that this pharmacy is doing what they say they're doing and trying to offer patients the best services and following the standard operating procedures that the pharmacy organizations deem to be most appropriate and kind of leading indicators of excellent service to our patients. So that's there are a multitude of accrediting bodies that you might see variety of specialty pharmacies when they're accredited. So I wanted to kind of touch on those. So I have a slide, the next slide here, that goes over some of the more common organizations that you might see a specialty pharmacy have as their seal of approval or seal that they're accredited by these different places. So URAC is I guess in the specialty pharmacy space, it's considered to be sort of the gold standard of they have the most robust and serious criteria and guidelines that pharmacies have to follow in order to be accredited. So that is probably one of the more common ones you'll see by a lot of the larger institutions. Probably second in line would be ACHC, or Accreditation Commission for Healthcare. So they're another big one in the specialty pharmacy space. And you can see the other three I have here. So Joint Commission, in addition to what you're probably familiar with hospitals and clinics, they do accredit the specialty pharmacies as well. So there's a multitude of organizations that can accredit a specialty pharmacy that kind of, if you're choosing a specialty pharmacy to partner with, kind of leads you to say, okay, this pharmacy is at least trying to go that extra mile, make sure that they're servicing patients and providing good care and good outcomes for those patients. And then the next slide here, I just wanted to throw in as a quick visual. This is the number of accredited specialty pharmacies across the United States. So this data is from 2019, which is the last time that this organization published their data on this, but all you can see here is that a lot more of the specialty pharmacies are getting dual accreditations. So for instance, our specialty pharmacy here is both URAC and ACHC accredited. So we have both accrediting bodies that come in and survey us and make sure that we're kind of up to speed on all the things that we should be doing. And then the orange is URAC only. And like I said, URAC is a big one in the specialty pharmacy space. And then blue is just ACHC only. So as you can see, over the years, more and more have gotten accredited just to kind of maintain that competitive edge on saying like we're trying to do all the things that we should be doing for our patients. Okay, next slide, please. So I also wanted to bring up that there are different types of specialty pharmacies. So some of the services and some of the things that you might see available will differ. So when you're trying to find a specialty pharmacy to partner with, these are the different ones that you may see available. So there are independent specialty pharmacies where they're not associated with a chain, they're not associated with a hospital, they kind of operate on their own. So those are things where, there's smaller chains of those independent pharmacies like Amber that's in the southern part of the state. And I've got some of those listed at the end here just to have some additional specialty pharmacies for their contact information. And then the retail specialty pharmacies, as the name implies, generally they're coupled with a community pharmacy as well. So these are the bigger ones that you might think of, things like CVS specialty. Walgreens has Alliance RX, which is their specialty pharmacy. So these are the ones that are usually the larger chains or the larger big box kind of specialty pharmacies. And then there are health system owned. So that's what Allied is we are part of WVU Medicine. So we are in partnership with the health system. In West Virginia, Marshall Health also has a specialty pharmacy. So those are the ones that are directly partnered with that health system that's local. Next slide, please. And I wanted to touch on some of the different services with specialty pharmacies. So this is kind of, I want to say generic in that there's going to be some variability, I guess is a better way to say that. There's variability with the different services that specialty pharmacies are going to offer to both you as the prescriber of the medication as well as your patients. So their services are more than what a community pharmacy would be able to provide. And that's the point. That's what makes us special, right? Is the additional services that we're offering. But there's going to be variability depending on the pharmacy. The stuff that I have a lot here is what our pharmacy, and I know a lot of the local pharmacies do, and some of it is tied to our accreditation. So if a pharmacy is accredited by one of the accrediting bodies I mentioned, they'll also usually have a lot of these services. So 24/7 access to a pharmacist is one of them. If you are URAC or ACHC accredited, you have to be available for patients and providers to answer clinical questions, whether it's Christmas Day, 3 a.m, whatever it is. So we do have a pharmacist that is on call 24/7 to be able to assist patients. I left my Humira out of the refrigerator. Can I still take it? I missed a dose. What do I do now? I'm having side effects. What do I do? Those sort of things. Some of the pharmacies for the next section here with the insurance, there are some pharmacies that aren't able to offer prior authorization services. Our pharmacy does, some of the other pharmacies I'll mention do, so they can assist with the prior authorization. So if you need help with the criteria, submitting it, following up on those things, some of the specialty pharmacies can absolutely assist you with that so that we can try to help keep the patient moving along in the process to get them authorized to start on therapy. Some pharmacies will also help with that financial assistance. So what I alluded to earlier with these medications are crazy expensive. The good news is that from a Hep C standpoint, all of our manufacturers are great about having copay cards and manufacturer assistance to bring those copays down to $5. So some of the specialty pharmacies will help patients get enrolled in that, as well as some of the non-manufacturer programs. So things like foundation assistance for our Medicare patients, so that they have some sort of funding and be able to afford their medications if their copay is really high. Some of the stuff that I'll mention here next is required as far as accreditation goes, and is one of the things that they really kind of harp on when they come and do the surveys and check our clinical notes and the data and show that we're up to snuff. Now I'm using Louisisms, but as far as doing what we should be doing. So the enhanced patient education. So we are required as a specialty pharmacy that we must absolutely talk to a patient prior to dispensing any medication and provide them education. Even if we don't, even if the patient always has the option to decline if they don't want to, but we do have to at least offer and provide patient education prior to them getting the medication. So that's something that oftentimes is different that you'll hear from a patient. They'll say like, oh, well, I haven't gotten my medication yet, or there is a delay. It's because the pharmacist might be actually trying to get a hold of them to go over that education to provide that to them upfront before dispensing that medication. And then we do the reassessment. So a lot of the pharmacies will, whether it's a technician, a pharmacist, or a nurse, will follow up with the patient and provide them reassessment on, are you adherent? Are you having side effects? What sort of problems are you having that we can try to circumvent so that you can get the best out of the medication? So those are required for all specialty pharmacies that are accredited. Same thing with the compliance and adherence management, providing services with text messages to reminding patients to take their medications, providing dosing calendars, all sorts of different options for patients to be able to stay on therapy and try to make sure that they don't have big gaps, especially from a hepatitis C standpoint. We utilize Epic here. So like I said, we're a health system specialty pharmacy. So we are connected with the health, the EHR, the patient's health record, so we can communicate through that. If you're not part of our health system and we're servicing your patient, we do try to make outbound phone calls, faxes, whatever service is best for your clinic to make sure that you know the patient's getting started and if there are any issues. So a lot of the other specialty pharmacies, especially the larger ones, you'll see that sometimes they have portals that you as a provider can sign in to have an idea about if your patient started on therapy or see some of that documentation. So usually there's some sort of connectivity where you can kind of keep up to date with your patient as well. The cold chain here is also something from an accreditation standpoint that you have to be really have a robust program on. That's not important for hepatitis C because these medications aren't refrigerated, but specialty pharmacies do have to make sure that they're tracking refrigerated products and making sure that patients get an appropriately stored product if we mail it to them, or that sort of delivery where they're not picking it up here. So that's really robust. And then reporting as far as payer and manufacturer goes, sometimes there are medications that we refer to as limited distribution. So some pharmacies really have to demonstrate their adherence and their clinical outcomes to both payers and manufacturers. So one of those things is, here at Allied, we have a contract with PEIA to be able to dispense for those patients. And they want us to demonstrate that our patients are being cured and they're adherent to their therapy and following up on that. So a lot of times, in order to be able to service those patients or to have access to those drugs, the pharmacies are going to make sure that they're demonstrating the value in using our pharmacy versus a different pharmacy. So those are some things that you'll see from a global service standpoint for a lot of the specialty pharmacies that you're partnering with. Okay, next slide. And again, this is generic. This is kind of our workflow. There is going to be some variability with different specialty pharmacies. This is, in full disclosure, the only specialty pharmacy I have worked in, but I do have a lot of other colleagues where we have a general sort of flow for how things work. So I just wanted to run through that just so that you could see have an idea of the general process of what happens when you work with that pharmacy and how it progresses for the patient. So to start, what we usually do here at Allied is the data entry piece, where we're entering the prescription in the most basic sense and then starting that benefits investigation. So does the patient have insurance? If they do, what's on formulary? And then if it needs a prior auth, which, let's face it, all the Hep C drugs do, and then starting that prior authorization process. And then once the prior auth is done, we look at the copay and say, okay, does this patient qualify for a copay card? If not, what about foundation assistance? And try to get all of that wrapped up in a nice little bow, ready for the patient. And then we do what we refer to as onboarding, where we'll contact the patient and say, all right, everything looks ready to go. We can offer our services and dispense for you, or you're welcome to use another pharmacy. As an aside, that's a West Virginia law. We have to offer patients their choice of where they want to fill. So we always ask them where they want to fill. And then if they do want to fill with us, we kind of move on through the rest of the process here. So the next step is the clinical review, where the pharmacist looks at the prescription, looks at all the notes, the blood work that you all provide for us, make sure there's no issues as far as appropriateness, drug interactions, that sort of thing. And then once everything is ready from that standpoint, we reach out to the patient and do the education. Like I said, it has to be done first. I can't send it out without talking to the patient. So I'm going to call them, make sure that they're comfortable with therapy, review everything with them, try to assess if there are any issues up front, and then try to mitigate those on the front side before dispensing to the patient. So if you go to the next slide, as we continue through the process, we get the medication scheduled to wherever they want it to go to. And then once in ours, we don't have to worry about cold chain here for hepatitis C, but it goes to fulfillment, where they make sure everything is packaged appropriately and then goes on and gets shipped to the patient. So a lot of the pharmacies, at least in West Virginia, have the option to use UPS, FedEx, some sort of third-party shipping distributor to get medications to patients. Some of the pharmacies have their own couriers to be able to deliver to patients as well. So trying to get it to the patient so that it's on time, so they don't miss any doses. All right, go to the next slide. So with us, just to kind of talk about, I kind of briefly ran through the patient education and the counseling. So I just kind of wanted some visual representation of what we do here with ours. So we do the initial assessment as well as follow-up, with has some similarities and overlap, where we're looking at that appropriateness. And then in addition to that, usually going over the adherence assessment. So I've talked about in the drug interaction talks before about trying to get schedules with patients if they have an interacting drug where we've got to do some spacing. So setting up specific time periods so that they fully understand what the regimen is, what time they have to take things, whether or not it's with food, and trying to get that schedule set up ahead of time so that they feel comfortable with, when I send it to them, that they know what to do when they receive it. So any of those sort of interventions, which some of you, we may have communicated back and forth, or with your other pharmacies on, there's a drug interaction. What do we want to do here? Change therapy, have them hold, and kind of work with you and the patient to try to get the best option for them to be able to complete the treatment without any sort of interaction, side effects, or concerns. And then on those refill assessments, going through and seeing, like, are you having side effects? What have you tried? Here's what we can do. And then trying to do assessments close up if we need to. So if there's a side effect where a patient says, I'm really nauseous, I can't tolerate this, following them a little bit more closely so that we can make sure that they stay on therapy and don't just quit because they're not feeling good. See if there's something that we can do ahead of that to get it on top of it. Go ahead to the next slide. And then this goes over all of the different touch points. Again, just a visual kind of run through of everything that we're doing when we're talking to these patients. So I've touched on some of it already. The education we provide, I've kind of alluded, is mostly attributed to the medication like I have listed here, but we do some disease or condition education as well. Sometimes they have questions. A lot of the questions I get is, can I drink alcohol when I'm done? Or is my liver gonna go back to an F0 at this point? Or those sort of things where they have questions about the specific disease and give that education to them as well. And then the proactive refills, our pharmacy does. We don't wait for the pharmacy to call. And I think that's pretty standard across the industry, is that they try to get the medication to the patient well before they should need it, so they don't have any gaps in therapy. So usually what we're doing is trying to call the patient ahead of time and get that out. And then the other stuff I've kind of mentioned here on the other slides, but this is kind of an all-encompassing slide of our patient management program where we do all of that clinical work. Go ahead and do the next slide. And these last two slides here, I wanted to provide contact information for the at least local West Virginia regional pharmacies. So Allied Health Solutions is our pharmacy here at WVU. So that's our phone number, as well as the link to our Hep C enrollment form that we use for folks that are outside of WVU to fill out information so that we can appropriately get the patient enrolled. Amber Specialty Pharmacy is down there in the Charleston area. The phone number I have listed here with the specific extension, as well as this fax, is specific to the Amber Specialty Pharmacy that's in Charleston. So they are an independent specialty pharmacy, but they're also, they are technically a chain. So they don't have, it's not retail, and that they don't have like a CVS on the corner, but they are a chain. But this is, when I spoke to that pharmacist down there, he provided me this information as well as this link here for their referral form if you're down in the Charleston area and want to use that pharmacy. So that will get you directly, that number, contact information will get you directly to them. If you fax it to the number on this form, that goes to the larger Amber pharmacy and will eventually make it to him, but this is kind of a direct way to get it to their pharmacy. And then Marshall Health, they don't have an enrollment form, but I've got their contact information for you to call their pharmacy and get to their specialty pharmacy division if you're down there in the Huntington area and want to use their pharmacy. Marshall Health does not offer prior authorization services at this time, but both Allied and Amber on this slide do offer some prior authorization services for patients. So I wanted you to have that info. And then the next slide, these are the larger retail pharmacies that are specialty pharmacies. So Accredo, CVS, and then Alliance, which is Walgreens Specialty Pharmacy. So their phone numbers as well as their enrollment forms to get your patients enrolled if those are pharmacies that you want to use. I know that both CVS and Alliance, they do have a special relationship sometimes with their local retail pharmacies, where the larger specialty pharmacy, like up here, I think the CVS that's local to us is in Monroeville in Pennsylvania, but they will send it to their like local Walgreens sometimes where patients can go pick up. So usually the larger chains will allow patients to pick up if that's something that they prefer to do rather than ship. So that's always an option too for your patients that maybe don't want it to get it to the mail, or they don't have reliable mail and they want to go pick it up. And I think that was my last slide. Yeah, so I'm happy to take any questions or anything about Allied or specialty pharmacy in general, if I can answer it.
Thank you so much, Rachel. I always love your presentations, especially the overview ones. I feel like if I was a clinician, I would have your PowerPoint on like under my favorites, so I can easily refer to it. So much, like, I'm not a clinician, but I can see all that helpful information on there. So thank you so much.
Sure.
Yeah, any questions, comments from the group?
Hey, I have a comment and a question. I'm a fan. I mean, to me, along with Echo, being able to work with you guys at Allied is what makes treating hepatitis C possible for me. It's unbelievable care coordination. I told somebody recently that I consider you guys part of my team.
I love that. Thank you.
I really appreciate it. So One question I have is, I'm about to partner with our local health department who got a CDC grant to refer patients in their harm reduction program for treatment for Hep C. And a number of their clients, I guess I should say, are transient. And what we were wondering about, I figured since you're on here, I would just ask you, but we can talk offline if we need to, is would it be possible for that subset of clients to list the health department as their mailing address and have their prescription go there?
Yeah, that's a great question. The main thing as far as us from a policy, so like if you would use any of the other pharmacies, I don't think that they would have an issue doing that. For us, the main thing is just proof of delivery so that we know that the patient gets it. So usually that's okay. So if we have a specific location, we've already communicated with that, and there's some way. The main issue is proving delivery as far as whether or not we use UPS or getting a signature from somebody. So like UPS or FedEx, and this is an insurance issue, right? So sometimes the insurance will say, well, you don't have proof you delivered it, so we're going to take that money back. So we basically gave away $28,000, right? Which is stupid, but that's a different soapbox that I'll stand on. But so proving delivery with UPS and FedEx, most of them will take that because UPS has their fancy stuff now where they have a pin drop and they can demonstrate where they showed it. Our other option is a signature. So if we're delivering it to a PO box, that gets a little bit hairy. But if there's a specific place where we deliver it and we have a signature or that pin drop, then that's usually not a problem. That's something that we can work out and put within our policy and our workflow so that that's taken care of. And that's specific to Allied. Like I said, I don't know what CVS and Walgreens or Accredo, Amber, I don't know what their policy is on that. So I won't be able to answer on their behalf.
Well, I appreciate that. And we'd also be working a small health department, and we'd be working with there's a nurse coordinator, so I think I can have her. We can work it out with you guys, I hope. So thank you.
Yeah, the only other thing that I can think of just off the top of my head, which is again a West Virginia law, is that like you mentioned, as far as them being transient, if we would deliver it, and this should be with any pharmacy, if the pharmacy delivers it and the patient doesn't pick up, legally we cannot take that back.
Oh, interesting.
Once it leaves the pharmacy, we are unable to take that back, use it as our own stock, and dispense it again. Despite there is something in legislation right now about proper storage and trying to create some sort of like drug repository, almost like a charitable pharmacy. But this is the West Virginia, Board of Pharmacy and Legislation. So that takes a lot of time. So right now, if I would dispense it, I couldn't take it back once it leaves the pharmacy.
Okay, good to know. So I'll that's good because we're just in the planning stages now. So I'll work with them on all that. Thank you.
Yeah, sure.
Thank you, Jen, for your question. Kaylee, I see you unmuted.
Yeah, Rachel, I just want to echo everything that Jen just said, and Mitra. I mean, you guys are absolutely wonderful. If anybody on this call is not yet using Allied, you guys are phenomenal. I mean, I rely so much on their expertise and just how efficient they are. They communicate so well with the providers. So thank you so much, Rachel. And
thank you. I will definitely pass it on to the team. They'll love you. Thank you.
Know this. I think I sing your praises like daily. But I had a question actually about PrEP with the injectable cabotegravir.
Okay.
We are trying. Well, we've been utilizing it almost a year now, I guess, in our clinic, and we are just having a lot of issues with prior auths and getting it approved and dispensed. And I just wanted to know if that is something that we'd be able to potentially utilize you guys for.
Yeah, great question. So with that, the main thing that I could see just from an insurance standpoint is whether or not a particular insurance considers that to be under the medical benefit versus the pharmacy benefit. So if it's the pharmacy benefit, we can absolutely do that. Our team specifically, and this is going to be for everyone on the call, a very WVU specific problem. But our team we do the pharmacy benefit. There is another team of folks that does things for the medical benefit for the clinics. So there's a little bit of separation between the two. Usually the flow for other clinics has traditionally, like an example that I can think of right now is like Prolia. for a lot of our ortho clinics. So they try it, the medical off team tries it first to get it off on the medical benefit. If it comes back where it says it has to go on the pharmacy benefit, then they let us know, and then we do the authorization for the stuff on the pharmacy benefit. And then we usually, because of being administered by a healthcare provider, we'll just deliver it to you in the clinic prior to the patient's appointment. So we have done that with Cabo a couple of times. We do have some patients from various clinics where we've done that and we've gotten it authorized on their pharmacy benefit and just sent it to the clinic for administration. So that piece we can certainly help you with and talk more about that. The problem is going to be the medical benefit because that's not our team, but for WVU purposes, I can get you set up with that team, Kaylee, that can try to help.
Oh yeah, that would be wonderful. Thank you. Thank you.
Sure.
Super helpful.
Awesome.
Thank you.
Rachel, hey, it's John. I'm gonna just emphasize what everybody else says. We love you guys. You literally make Hep C therapy, to use an unflattering military analogy. You make it a fire and forget medicine. You know, I write the prescription and you guys autopilot it from there on out. So appreciate you. I had a weird question. Is there a geographic benefit of using a specialty pharmacy that is like, you mentioned if like you're in the Charleston area or blah, blah, blah. Like, is there a real reason to pick one closer to you or your patient or not really? I mean, because it's the reach of the mail is everywhere.
Yeah. Well, I don't know if you all were familiar. There was an impending UPS strike that had us a little bit of a panic that didn't happen. So perhaps that could be, we were trying to get some plans in place for, you know, and FedEx was not, they were like, listen, you can't just dump all of your stuff on us. You gotta give us a heads up. So that would be one issue if there were ever something like that to occur again. We were, because we were trying to think like, where are we going to transfer all these scripts so these patients don't have gaps in therapy? So because that's fresh, that comes off on the top of my head. But as far as outside of those strikes, probably not really, just because most specialty pharmacies are going to be using FedEx, UPS, or one of those like-minded kind of services where they could ship it to pretty much everywhere. For us, because we're WVU Medicine associated in here in West Virginia, we are actually only licensed in West Virginia, the surrounding states, and Florida, because we have a lot of snowbirds, so we ship there. So technically we have to be licensed in the states that we ship to. I can't just randomly like have a patient in New Mexico. So I know for us on the call here, this is very West Virginia group. So as far as regional goes, like we should be able to service, as should most of the pharmacies. But like if you would have a patient from a telemedicine service that's in like Minnesota, Allied wouldn't technically be able to ship to them from a legal standpoint. So you may at that point have to go with a larger, like a CVS, Accreditation or something, because they're licensed in all 50 states. So that would be something to consider if you do have a patient that is not local. But other than that, with the services.
What about, okay, that's a beautiful answer. I thought maybe you just made Louis drive to, you know, New Mexico or something. But hey, so how about Ohio, Pennsylvania, and Maryland? You guys?
Yes. We're licensed in all the surrounding states here. So Ohio, Pennsylvania, Maryland, Kentucky, Tennessee, and like I said, Florida. And we are in the process right now of getting licensed in North Carolina, because that's the other place our snowbirds go.
Thank you.
Mm-hmm.
That's awesome. Thank you all so much for the questions and comments, and Rachel for all your answers. Any other questions, comments from the group? Alrighty. Well, thank you again, Rachel. We so appreciate your time and you sharing your expertise with us. It's always so nice having you present. And thank you all for joining the session as well. My only announcement is that the next session will be on September 14th, and Dr. Feinberg is presenting on PrEP. So keep an eye out for that reminder. If there are any questions in the meantime, you can always reach out to myself or Elizabeth. But I hope you all have a wonderful rest of your day and rest of your week and weekend ahead. Thanks, everyone. Bye.
Thanks, y'all. Bye.